People are still coming into the room, but we'll take a couple of minutes and just do a couple of introductions and then get into the heart of the matter after that. So, hi everybody, how's it going? Good to see you all virtually. This is Jim McCarthy. I'm the CEO of Gold Star and I'm the host of today's expert chat with a couple of guests that I think you're going to love hearing from, and some new data that I will share with you in a second. But first, I'd like to introduce you to our two guests. First, I'd like to introduce, as my clock rings 12 times. Perfect timing on that. First, I'd like to introduce someone that many of you in the industry know and have worked with. She is the Vice President of Marketing for Nederlander Concerts, is based here in Los Angeles. She's responsible for the online development, marketing initiatives, and promotional campaigns for all of Nederlander's venues, which are beautiful, and booking in third-party facilities. And before that, she was Senior Director of National Tour Marketing for Live Nation, where she developed national tour marketing plans for such luminaries as Def Leppard, Avril Lavigne, Project Revolution, and a bunch more. She's a legend in the live entertainment marketing world. Please welcome Jamie Loeb. Hi, Jamie. How's it going?
Hi, good. You're going to make me blush. My goodness.
All right. And second, as those of you who've joined this before know, one of our goals is to have a kind of an interesting balanced perspective where we have somebody from inside the live entertainment and performing arts world and somebody from the public health, medicine, virology, kind of more on the science and on the more scientific end of the discussion, because we're here to talk about reopening venues safely and successfully returning to live events. And so I'm actually really grateful to have our next guest with us, who is the Johns Hopkins University Vice Dean for Public Health Practice and Community Engagement, the Director of the Bloomberg American Health Initiative, and Professor of the Practice in Health Policy and Management. Like all of us, I think, he served as the Secretary of the Maryland Department of Health and Mental Hygiene, kidding, and was the Principal Deputy Commissioner of the U.S. Food and Drug Administration, Commissioner of Health for Baltimore City, and an elected member of the National Academy of Medicine and the National Academy of Public Administration. And apparently, Josh, you and I lived in the same dorm, but somehow didn't know each other.
I don't know. Well, like I told you, it's because I wasn't very social in college, I think.
Well, be that as it may, you're a wonderful guest for us. Please welcome Dr. Josh Sharfstein. Josh, thanks for joining us today.
Sure. Thanks for having me.
So we've got a nice, good group of people are still coming in a little bit, but the first thing I want to do is talk about the data. So I want to review what we're doing. I'm going to share screen now. As some of you know, Gold Star has been doing a fairly large survey twice a month among our consumers, and the goal of that is to get a sense very strongly of what the consumer sentiment is. We all know that the law is one thing, and even safety is one thing. But if consumers are not interested or willing or comfortable with going back to a live venue, it really doesn't matter. So for our part, we're trying to do something that we can do, which is to get a pretty broad snapshot of what's going on among live entertainment buyers and share that information. So literally, the goals of this project are to gauge the ongoing sentiment of the event going public. And in particular, the people who go out a lot. So the frequent and semi-frequent event goers that I think those of us in the business understand really make up the heart of the economic activity. And then to share it with everybody, including especially Gold Star event partners, the several thousand of you out there. There's a couple of things about the survey. We're doing it twice a month. We did it in early May. We did it in mid-May. We're queuing up the early June survey in the next couple of days. And we're going to keep doing this and tracking change, which I think is really the most important thing. The other thing to say is that we're doing this in all ages and many major metros. We added another 5 metros to this survey. Adults from age 18 to whatever, broken down into several groups, which are obviously, especially in this particular situation, age is a particularly relevant variable. They are frequent event goers. 67% of this survey's respondents said they go to live events at least once or twice a month. I mean, obviously that means normally that's what they do. And in this survey, we got 4,215 respondents, so it's a a pretty large sample, the results should be pretty reliable, even at the metro level. So that's just the background. You've heard that before if you tuned in for the last one. But with no further ado, let's talk about the number one. The headline for this survey and for all the surveys is the return readiness score. So this is the answer to the question that people gave. Right now, describe your willingness to go out to live events where you live in general, assuming they were legal and being produced. And the interface that people had was a slider bar that they could take from 0 to 100, where 0 meant I wouldn't go at all. 50 meant maybe I would, but maybe I wouldn't. And 100 would be I definitely would go if I could and they were being produced and legal. So the reading for this month, many of you will recall that last month, or in the last survey, the reading was 40. The reading this time is 37. So we had a slight dip in people's overall readiness to return, and there's some interesting breakdowns of that. But I guess I've got my first question is to Josh, who didn't see this data before. What's your reaction to this number, just right off the cuff?
Well, let me ask you, do you think people had in mind indoor versus outdoor venues, or what kind of, I mean, maybe people's picture of what they would do is a little bit different.
Yeah, that actually we have some questions that address several of those. This is meant to be just the overall, like taking everything into account.
Yeah. Well, I mean, I think that the challenge that we have is that we're learning a lot more about how the virus is transmitted, and it's transmitted primarily by respiratory droplets, which come when people talk or yell or sing, and they're transmitted when people are close together for lengths of time. So, a concert where people are singing along with their favorite songs in an indoor environment is probably one of the worst environments for it.
It's almost tailor-made for transmission.
Yeah, the virus is rooting for that sort of environment because it's like perfectly designed. And so, if people have that in mind, I think at this point in time where there is community transmission, that would be a really difficult sell. On the other hand, if you're thinking about an outdoor environment with fewer people, it's certainly not what people might have in mind, for usual live music, that I don't think that's inconceivable. But the indoor packed club kind of environment is really difficult to imagine now because of everything that's coming in. I mean, you may have seen this story that like one choir practice and 2 people died, all these people got sick, dozens of people. And so it's it can be, these are like the super spreader events people are trying to avoid.
I just read something that speaks to that. That there was, I don't know if it's the same choir practice that you just referenced or a different one, but they were keeping socially distanced, what they thought was socially distanced, 6 feet apart. But then they found that through singing, and I've heard the same is true for exercising, that because of the projection and because of the breath and the output, that droplets actually travel farther in those situations than the normal 6 feet guidelines. And they're saying that you need to be as much as 16 feet away in those situations. Am I understanding that correctly?
I think you said that very well. I mean, I think that it is exactly the case that when you're talking normally, you're talking about a 6 feet radius, but when you're sneezing, coughing, singing, breathing really hard, it can get propelled further. And it's not just that, it's also the length of time. And so the length of time of exposure
that's the other thing that I've heard, because everybody gets hyper about the grocery stores and what you need to do to disinfect all your groceries when they come home and passing people in the aisles. But they're saying that you need to be, I don't know the specific amount of time. You might be able to expand upon that, but that passing somebody in a grocery aisle situation isn't enough exposure to really transmit, that you need to be in the area for an extended period of time.
That's true. I mean, for finding someone who's a contact, right now, the rule of thumb is 15 minutes within 6 feet. That's not, at a party or at a indoor venue, but it's 15 minutes within 6 feet. So just walking past somebody in the aisle, is very unlikely, or jogging past someone or something like that. Those are not really likely things. In some cases, amidst thousands of potential contacts, almost everybody was in a household. So it looks like it's actually much less likely to spread from relatively casual contact. But in these kind of, cramped environments where there's prolonged intense exposure, and particularly if people are releasing a lot of virus, that's really the worst case scenario. So that's why sporting events, particularly indoor sporting events, are not going to have crowds, and you could imagine few fans at outside sporting events, but even there, I don't think you're going to want to pack them together so much.
All right, why don't we press on with some of the data that digs into some of the stuff that you guys have brought up here, because it's all pretty interesting. So this is just showing that we were at 40 in the last survey, 37 here, and I'll actually break down why that is for you a little bit. A lot of you in the Facebook group have been asking about metro area breakdown, which we've done, but thought I'd chart the whole thing out for you this time. What's interesting is that LA and San Francisco and Chicago, for example, have stayed roughly at the same number. LA was at a 41 last time. San Francisco, I think, was 39. So that hasn't really changed. Chicago, a very similar number. We added Dallas to the survey, and Dallas is a sort of outlier on the high end at 50. And we added DC, among others. And DC was a real outlier on the low end. DC, possibly because people are, more people work for the government or something. They're very aware.
No, I'll tell you why that is.
Yeah. Okay.
DC is one of the areas with the fastest growing epidemic still. So it's only now starting to reopen, and people have been, so I think they've had it more intense.
So that part of the reason that the number came down is that we actually added DC to the survey, and it turned out to be an outlier. And then I thought maybe we somehow sampled an older skewing audience in DC, but as it turned out, I look back and at every age, DC was an outlier on the low end. So
right. But your theory could be true as well, I want to say, but I think it has been hit pretty hard recently.
Yeah. So, and as you see in between, if there's so we added several metros. So the first reading that we've gotten on Houston, no, we did Houston before. Houston's 38. The interesting thing is there's a West Coast number and an East Coast number. The East Coast number overall was 33. The West Coast number overall was 40. So we definitely saw a kind of a division there. But the overall number, I would say, didn't move all that much, except by the addition of new markets. We added San Diego, which is very similar to LA and Orange County, and the rest of the West Coast for that matter.
I mean, Jim, the other thing to note is that, okay, DC is the outlier in that it is the least likely to go out, but 28 compared to 32, it's 4 points. It's not like it's a 10-point swing or anything. It's not completely off the charts outlier.
Yeah.
So
yeah, the average is 37. So it's not, you're right. It's not a complete, it's not like nothing's happening, but it's definitely lower than the rest.
One other thing to consider is that where you say assuming they were legal and being produced, sometimes people feel like if things are legal, it's probably okay that there's someone vouching for it.
Yeah.
So this might overstate people's willingness. Like if you said assuming they were legal and being produced, but the health officials said they were dangerous, then you might see much lower numbers.
We might. And the reason the question was phrased that way is we didn't want people to say, I wouldn't go because if it's not legal, I wouldn't do it.
Right. You're right.
We wanted to remove the barrier and kind of see what that did for people. And we can actually, once we get through the data and, with all of you tuning in, we can talk more specifics about metro areas too. We also asked the question, how does this vary based on the size of the venue? So we asked, and then we asked this before, and the numbers were roughly similar in terms of their step down. We said, okay, we asked in general, how about in venues that are 250 capacity and lower? How about in medium-sized venues? And how about in large venues? And actually what we're seeing is that people's overall number is basically their small venue number. They're sort of looking at it and saying, well, if I'm going out, I'm going out in a small venue. So this staircase structure stepping down from small, medium, and large is exactly the same way it was last time. I don't think anybody's surprised by this. This is kind of what we were saying before. Obviously, age, as we all know, plays a big role in one's susceptibility to harm from this whole pandemic. And so one of the things that we did last time and I've done again is look at it in terms of group by age and how did they respond. So the interesting thing is that there's not really much difference between the 35 and unders and the 35 to 65s in terms of their willingness right now at 41 and 40. Both are down just a little bit from last time, but that we still see a big drop for people 65 and older, and that actually dropped from last time by 5 points. So I don't think there's any surprises here, but that difference is significant. And then if you cross tab this, I did this just to see sort of where it lined up. If you cross tab 65 and up with large venue, right? So people 65 and up, how willing would you be to go to a large venue? I think the number was 12. So we're very, very few takers in that group on large venues. We rephrased this question because I think the way we asked it last time confused a few people, but we said, looking back at your answer to question 4, how would your willingness right now to go out to live events where you live in general change, if at all, if venues adhere to strict cleaning routines and social distancing of patrons within the venue? So in that context, cleaning routines, social distancing, the overall number rose from 37 to 47, which is more of a lift than we got from this last time. I don't know if that's indicative of people experiencing it more, or I'm not sure. Let's see. This is a question, and this is the point you were making earlier, Josh. We asked the same question, except we said, what's your willingness to go to live events in venues or locations that are outdoors, such as gardens or zoos, or that don't require patrons to be seated near each other like museums and aquariums? And the number's a lot higher. The number's 55. Mm. We didn't do this question last time, so we don't have a comparison point, but that's actually the most favorable number we've gotten. The interesting thing about this number too is that age didn't really change it very much. There was very little difference across the age groups on this.
I'm interested in the fact that people perceive the smaller venues as a little bit more accommodating, but maybe I'm wrong. I'm imagining these smaller venues are a little bit more packed in and inside, so they make me more nervous even.
Well, the difference with the smaller venues is just the sheer number of people that you could come into contact with. And I think that's, whether right or wrong, that's why people are feeling safer. And I know as far as restrictions are concerned and reopening plans, I believe that smaller venues are more likely to open before larger venues. So for that reason, it's just easier contact tracing and less, even though what we were just talking about, that everybody singing at the top of their lungs in each other's faces isn't good, that if there are fewer of them, that it might limit the exposure. But Dr. Sharfstein, is that in your mind, is that an incorrect way to view this?
Well, I think particularly I guess I'm thinking about kind of the environment that you're in. I think of smaller venues as, pretty packed in and maybe a lower ceiling and, more intimate, but that means a lot less air circulation. Larger venues, much bigger. I'm not saying I'm be a big fan of large venues, but I wouldn't necessarily be so excited. I wouldn't personally see that much of a difference between them. And, as one individual, you're not surrounded by 100,000 people at a big venue. You're still only surrounded by a few people, but you'd be much better off in a stadium than in a little bar, where the same number of people might be in your direct vicinity and the air is not circulating. That just seems like it's like that choir practice, but, multiplied.
And that's something that I know that a lot of promoters, including us, are looking at, is that taking some of the larger venues that we work with and just putting fewer people in it so that you can space them out better. You've got the room, you've got, just book
Right,
it
and maybe
for
combining it with an online component or some other,
yeah.
so it's a real thing, but people can watch, and you have some people who get to be there, but they're spaced out. Like, to me, that would be totally imaginable. But like saying we're gonna, be inside a club, I mean, at this point, in any place where there's community transmission, I would be nervous, because it's, if you're there for 2 hours and the air is just sort of sitting there, it's I think that is near ideal conditions for, particularly without social distancing inside like that.
Well, and yeah, and in my mind, where I think the issue is particularly in smaller venues, well, bigger venues too, is general admission, where people don't have assigned seats, because you can have 100-seat club and only let in 20 people, but all those 20 people smoosh against the stage, you've got the same issue.
Right.
Yeah.
Interesting.
And then we like to finish this every time with the positive thing. How much are you looking forward to being able to go to live events, sports, entertainment, and arts again in the future? Once again, very high number, 83. I just put this in there to cheer myself up and to cheer all of you guys up about this.
I hope that number is staying high. It's not dropping.
No, it's actually exactly the same as it was in early May. So hopefully that keeps going up. But it's already really high, so that's good. And that's it for the data. I'm going to stop sharing my screen now if I can, and then we will engage the conversation with everybody. I know we have questions coming in. Why don't we just start on those? And by the way, I really appreciate you guys jumping in as those slides were coming up. That was really great. Let's see. Okay, an anonymous attendee asked, is it too pessimistic of you to say live theater and indoor concerts are not feasible until there's a vaccine? Ooh, that's a big question.
I was actually, Dr. Sharfstein, that dovetails off of a question that I wanted to ask you, in that, you've got different businesses that are doing temperature monitoring right now, but we know that there are asymptomatic people out there who can spread, and that temperature is it's not the end all be all. So in your mind, what's a better litmus test? Is it a better antibody test? Is it a better COVID test? What needs to happen in this space?
So you're definitely right. The fever testing doesn't do very much at all. So most people don't have a fever when they're infectious. So it's really not that won't be, it'll catch a few people, but it won't reduce the risk really significantly. Testing, of course, comes to mind. It's like, could we just test people and not let people in? Problem is, testing right now, the technology is not that good. That's probably about 70 to 80% at the peak of infectivity, that you can catch 70 to 80% of the people. There are a lot of people who are very sick, who are getting into the hospital, who are testing negative, but clearly have it. And eventually they find it, but not even when they're quite sick. And then when you're not that sick, the test can be harder to pick up, because you're trying to test, you're like scratching inside somebody's nose, but you're not that sick. So you don't really have anything coming out of your nose. So you're just less likely to find it. And that may only be 50, 60% likely to find it. So, this is a piece that I wrote with the head of infection control from Johns Hopkins and USA Today recently, which is that unfortunately testing's not a magic wand for the workplace, because there are a lot of employers who are hoping that they could just use testing and not have to worry about social distancing. It's really social distancing that reduces the spread of the virus, and testing, helps figure out where it is a little bit, but can't be done that well. Now, there are, in theory, that, better tests could be, produced, but I think we'll probably have a vaccine before we have a real breakthrough like that in testing. So it's most likely that, you will be faced with this question, which is some risk. So like going back to like the usual way of doing concerts is kind of inconceivable to me without a vaccine in an indoor environment. So the question is really, is there an alternative way to doing it, and we've talked about a few different alternative ways. A couple other concepts to throw out there is you could allow groups of people. It was interesting. You made me think about this when you said, it's just sort of random people selecting coming to an event. But if you figured it out in a way, and again, I like to think about outdoor more, but you said like, look, we're going to create little islands for people, and it can be people that they've already been hanging out with. So it could be, you're a little social circle with like 4 families and everybody's been doing well and seeing each other for a while, or a bunch of friends, they could all go and you get a little area and you're way away from everybody else.
I think that has been suggested or asked by a couple of people. If you had let's say a venue that's built for 500, but you bring in 125 or whatever small proportion and spread them out.
Yeah, but you wouldn't necessarily have to spread everybody out like 1, 1, 1, 1, 1. I mean, like if I'm, somebody's living with their partner, the 2 of them could be right together. There's no reason that they've already shared everything, so they're fine if they're singing next to each other. So you could imagine some scenarios like that. You could work it out with it's just going to be a very different kind of experience under those circumstances. But I'm still very nervous about like indoor environments generally, and environments where you're expecting people to be singing. I'm talking about the fans particularly. Like you could, there was just a report released by Actors Equity that had a guy I know as their major scientific advisor, and they said basically that the upshot of the report was that it was kind of hard to imagine reopening live theater until there was a vaccine. I think, the advantage is if you had everybody very quiet in the audience, and just wearing a mask and sitting every other seat, you could kind of imagine an audience like that. That would be pretty safe. You'd have to do something pretty aggressive to make sure that the cast is safe. So, you could kind of imagine like a potential way, if you really were going to try to do it, it might not be worth it after all that. But yeah. You could kind of imagine it. But if the crowd is going to be singing, that just adds this entire other level of.
Well, we've definitely got both music and theater people and more than that on this call today. So that sort of, the sort of concert experience of singing along and, I don't know, like standing up on your chair and, waving your cheek. That's all. That typically doesn't happen on Broadway.
Yeah, right. Exactly.
Yeah, I was just going to say that Broadway tends to be much more subdued in that way. But the other thing that I personally have that's been rolling around in my head is, and we've seen it with different events that have started to come out, is that people are social animals, and they want, as much as they want to connect with their own pot of people, they just are happy to see other people, and it's difficult to keep them confined to their pods. Mm-hmm. And, you take it to the extreme. You take someone that says, oh, that's my cousin Larry that I haven't seen in 6 months, and I'm going to go say hi, and what are you going to do about it? Like, then the security nightmare that you're dealing with, trying to contain that person and keep everybody safe and keep your security safe. I haven't figured out how to. Well,
the other thing, the image that popped into my head a little while ago was when we were talking about administering tests, at the door or something. So Jamie, I'm just not looking forward to the day when you're like, Jim, guess what? I'm managing my security team to administer these tests, and it's a nightmare, right? Like that doesn't sound great. That doesn't sound great to me.
No, it doesn't. It doesn't. But we got to talk through every option at this point.
Yeah. Somebody was asking about air conditioning. That is air conditioning, again, we're talking about indoor.
Generally better. A working air conditioning system will replace air and will, move air around. More air circulation is generally better. There's a group of air conditioning engineers that have posted all this information about that.
Having said that, what was the thing? There's the famous diagram of the restaurant in China where someone was sitting under the air conditioner vent. I think this has created some ambiguity about the role of air conditioning.
It has created some ambiguity. Even in that situation, though, the people who got sick were right around the person.
Yeah.
It wasn't like the whole restaurant.
Yeah.
And but I think that was not what we would call like a central air kind of situation. That may have been just like essentially a fan.
Mm.
But but in general, and this is not just from this, there's a lot of central air out there. There are a lot of people who are on common central air platforms and apartment buildings and other things does not get transmitted that way. And SARS only was really transmitted that way once, the original SARS, when there was a really broken air conditioning system in a high rise in, I think, Hong Kong or Singapore. So it's, in general, I do not think that people are overly concerned about.
So what made the air conditioner broken such that it spread the disease?
It was like, it's a good question. I think what made the air conditioner broken was that there was some kind of leak from one apartment to another. So it was like condensing, leaking, and just coming right into the other apartment. But I wouldn't bet my life on that. But there's a good there's a good paper written about that we could share, I'm sure.
Yeah, and actually I'm seeing people ask for us to share various resources as we're going.
Yeah, I'll put in the link because I was just looking it up for somebody. It's like the air conditioning engineers.
And if there's anything we miss, everybody, I'm talking to everybody now, we'll get it. We'll get it to you in one form or another after the fact. So don't worry about that. Now, is it with air conditioning? Is it the moving of the air, or is it the filter in the air conditioner that does the good work?
The moving of the air is probably the most important thing. It's a replacement of the air. So recirculated air not as good as air that's coming in from the outside.
Yeah. Another person. Let me see what the question exactly was. A lot of talk about public bathrooms and portable bathrooms used at theaters, concerts, indoor and outdoor. The question is, how high is the risk on surfaces like those? But I would broaden that question to say, how high is the risk overall of, is it just a matter of when you're on a Broadway, in a Broadway bathroom or a bathroom in most concert venues, you're standing in pretty close proximity to each other. Is it the bathroom itself, or is it just what you do in order to queue and that kind of thing?
What you do in order to queue would be, not a good. And also when you're in the bathroom, it's like not a lot of air circulation and everybody's kind of pressed in there. So that's not a good situation either. It's possible that you can get exposed. I mean, I had like 100 people email me some story about like when you flush the toilet, there's a plume of things that goes up 6 feet. I would put that, classify that as like unproven as a major source of transmission. But, you certainly can have droplets that, or virus you're leaving around as you're touching things in the bathroom, but at least people can wash their hands. So I think it's mainly the other people.
Yeah.
And also, virus can hang out in the air a little bit. So, if you're just like, one person after the other breathing the same air, it's not a great situation.
The other thing that comes to mind for me, Jamie, is there's the sort of platonic ideal of what the policies would be. And then there's the reality of what happens when you get people together, right? I mean, even people who are, theoretically highly sympathetic to not getting sick or getting other people sick. And you live that life under normal circumstances, right? I mean, like there's challenges there. What do you think are that? I mean, you mentioned one, but that's something that I actually don't think we've talked about enough is that what you say or what you state as requirements, someone may just decide they don't want to do. And they may not even be, necessarily belligerent about it. They may just go like, well,
you don't serve alcohol at these venues, do you? So no, yeah. I mean, sometimes that can affect people's better judgment a little bit.
Exactly. It's a combination of happy, of alcohol, of
That's why people love going. I mean,
it's a combination of all of it. And even at the Keith Urban drive-in concert that they did, it's my understanding, and it was for healthcare workers. Like it was to honor healthcare workers and first responders, and they had trouble staying at their cars. They had trouble not roaming and wanting to communicate with people in other cars. And they know what this is, and they couldn't, they couldn't help themselves. So if they're having trouble with it, then I don't know how we expect Joe Blow public not to have a problem with it. And I don't know. We're talking about, and it's also my understanding that people were allowed to, sit on their car or sit around their car or whatever. I don't know the specifics of the instruction, but I know that what we're talking about is asking people to, stay in your car, only leave for restroom, and here's how you access restroom queue and that sort of thing. So, but again, this is brand new territory. We're just all trying to figure it all out.
I mean, I think part of this is bowing to the reality that people aren't going to sit at home for the rest of their lives. Are we really talking here about harm mitigation, do you think, Josh and Jamie both? I mean, is that what we're trying to, because let's say it's not perfectly enforced at a venue, which nothing is perfectly enforced at a venue ever, right? Like even not taking pictures, things like that, right? Are we talking about taking the harm down from whatever it would be at completely unregulated to 5% of that? Or, is that what we should be thinking about? Or is it more just like, how do we perfect this so that it's a completely safe activity?
Well, nothing is a completely safe activity.
Yeah.
Nothing's a completely safe activity. But, right now you're just living in the range of pretty high risk activity. And, it's not inconceivable that you could have a lot of people sick, including some people dying, just like, you've seen in some of these outbreaks that have happened. And that's a high risk activity. And so, we should start to talk about some of the technologies that might come online that might be more helpful beyond testing, that, we could talk about a little bit, because I do think, and also the fact that there's a lot of good reason to believe that immunity does exist and that a vaccine will be possible. So I think one of the things that's so frustrating right now, and different conversations I have, and I feel it myself, is just the sense of uncertainty, and how long will that uncertainty last? And if you look back even a couple months, we were uncertain about whether our hospitals would have enough beds, and now we've gotten over that. And if we could go back 2 months and talk to ourselves and explain that, we'd be like, oh, thank God, well, okay, that's good, but now we don't even think about it because we're at the next level of uncertainty that's there. But yeah, go ahead.
You're saying that we're over that hump, but I just read something about Alabama and Montgomery. I think they have one open ICU bed in the biggest hospital in Montgomery. And, so, and that's another thing that I wanted to talk to you about is, like, this is different depending on what state, what county, what region you're in, and how, and that's also, like, Jim, to go back and respond to what you were asking. But as I just said, different territories have different regulations. And I think that as promoters, we have to be very mindful that we are keeping up with whatever the regulations are in wherever we're trying to put on a show. Obviously, the restrictions in California are much tougher than they are in Texas at this point. So as long as we're making sure that we're complying with wherever we are and trying to keep our people as safe as possible. I mean, just because, somebody may be, we think that somebody may be a little bit lax on their rules, we can suggest that people are wearing masks, even if there's no requirement in place. We can suggest that people social distance, even if there's no requirement in place. Like, there are things that we can continue to suggest in areas that don't necessarily have those specifications that we know are more likely to keep people safe. But as long as we're complying with what's going on, you are right. People are going to do what they're going to do. But it's also, I don't think that we're going to get people buying tickets to these events in whatever shape they exist in, who are then going to go and say, oh, you're not putting me in a little plastic bubble. How dare you? So I think that there are a few things in play here.
Yeah. Well, it's going to be interesting. I mean, I do think that you may see that places hoping that it's safe to do things like Alabama has been, or Georgia, and it's not safe to do things. And, my point looking back was that some of us were fearful that no matter what we did, we were going to get hit with an overwhelming of the healthcare system. Now we know we can avoid it. It's up to us whether we can avoid it.
Gotcha.
But this state of uncertainty that we're in at the moment is not going to last forever, just like the last state of uncertainty didn't. We're going to know a lot more about different things, including the timing of a vaccine, the timing of antibody treatment that could be extremely helpful, both for sick patients and even as a form of prevention, which we should definitely talk about because I think it's particularly relevant for this stage. And so, we don't have to, I don't think personally, we have to think about making decisions like we will always be like this. The entire future of our industry is based on us opening under the exact conditions we're in now. Like if I told you for sure by, April 2021, the entire population would be immunized, that might, give you a completely different outlook on how to plan for things, what to do. Like how much risk do you really want to take in Alabama with a huge concert with a lot of community transmission where you could be stuck with people getting really seriously ill in the short term when you could just wait a few months, So I think that it's that sense of like, how long will this uncertainty last that makes people not exactly act out, but like just say, well, we've just got to live our lives. We've got to live our lives without really thinking about what could change. And I think science is advancing pretty quickly and things will change. And it makes sense to be as prudent as possible, regardless of whether you have local governors, who aren't being that prudent.
Then Josh, you're pretty optimistic about vaccine, antibody treatment, that kind of, you're pretty optimistic about that as it stands right now?
Yeah, I would say that there's pretty good reason to believe that immunity is a real thing for this. Like if you think about HIV, there's not a lot of immunity to HIV. People get HIV and then they have HIV and, there are a couple people in history have been able to be cured of it under certain circumstances, but generally speaking, every single person is stuck with it, and they just are managing the disease, which is great, but it's unfortunately very hard to have a vaccine for it, in part because immunity is so hard. But for this condition, it looks different. It looks like people clear the virus. A lot of people get neutralizing antibodies to it. You can induce a neutralizing antibody response. The early data on giving people convalescent serum is generally good, and we're going to get more studies this summer. People are developing monoclonal antibody treatments, which should be available before the end of the year, which are like manufactured antibodies. And this is an important point, even before a vaccine, those can be given at least they have in the past, if it works. Again, maybe I'm a little bit more optimistic today than I would be tomorrow. But, the idea is you can give these not just for people who are sick, but, for measles 100 years ago, they were giving antibodies to prevent people from getting infected who were exposed and they didn't get infected. And so there are ways to use them, strategically. So like, I don't think you could give them to 100,000 people going to a concert. There won't be enough. But in theory, you could give them to a cast, and protect them for a month, and so just like you would give them to nursing home workers.
I love the optimism. Thank you. I needed it. Because well, actually, you hear such, go ahead.
Well, I was just going to say, Josh, do you know Dr. Vincent Raccaniello at Columbia Virology?
I don't know him.
He's been on before as well, and he was equally optimistic about treatment sooner rather than later. On I think the last the last time we were on. So the fact that both of you are optimistic about things, even pre-vaccine, that might be helpful is encouraging to me as well, Jamie.
Yeah, but I mean,
yeah, I needed that. Thank you.
I mean, I think that there's, we have at our university, Johns Hopkins, a big study going on now on convalescent serum. I think that I don't think that's going to solve the problem of indoor concerts alone. But I think that
deflate the balloon, Dr. Sharfstein.
What's that?
It's a way to deflate the balloon.
I'm sorry, but it could be helpful for some of the things that you're doing. I don't want to. I'm sorry. I think it's going to be interesting. I think by the time you're having a big concert somewhere, there's another scenario here, which is that even in the places that are more aggressively opening, they realize big concerts are towards the end of the line, right? So that's not the first thing they're going to do. And there's it's likely that if they run into trouble, they're going to run into trouble well before they do a big concert. So you may never get to the big concert there. That's my,
until the end.
That is one potentially short-term scenario that would not surprise me. Like if people in Texas are excited to do it, but in the meantime in Texas, they're being encouraged to just go back to their way of life because the lieutenant governor thinks, the risk is worth taking. I think that if you really start to see major problems, there'll be a backlash. It'll be very hard to keep doing this. And then you'll run into the people won't want to come because they'll be so scared based on the illnesses that they're seeing around them.
So I think it's a bit of a mixed bag, but I think as you said, Josh, we are learning more as we go. And I think that that's true both on the science and medicine side and also on the industry side. So I want to thank both of you for being here today and for all of you. We didn't get to every question. I'm sorry about that. We never can. There were a number of resources mentioned, papers and other things. We will share those later on. I'm also going to do just a very abbreviated run through of the data on a kind of just a video form in the next couple of days, and we'll have this recording as well. So I'd like to thank Dr. Joshua Sharfstein and Jamie Loeb for joining us today. It was wonderful to talk to you guys both. And let you know that we will be back on June 10th, and we'll have a fresh set of data, early June consumer sentiment data, including a new return readiness score for consumers. And one of our guests will be Kevin Lyman, who, Jamie, I know you know very well, the creator of the Warped Tour, but also part of the Event Safety Alliance that created the Event Safety Alliance Reopening Guide. So we'll be able to ask him about that, which has been a very interesting document for people. So that's something to look forward to. And also don't forget about the Show Up Facebook group. The link is in the chat right now. We're sharing a lot of these resources there, including the link for the next chat. So there's a lot there, conversations going on, and we appreciate it. So thanks, everybody. We'll see you next time. If there's anything we can do, let us know. In the meantime, stay safe and keep the flame burning. We'll get there. Thanks, everybody. Bye. Crachez-vous dessus, il est encore temps.